Good morning, everyone. We're going to give this a few more minutes while people are signing in. Welcome. I hope everybody can hear me. If you are having technical difficulties, please type messages into the chat box and Louise McLeod will try to assist you.
I do see one attendee with their hand up, but I'm not sure if it's a technical question or just a hello.
Okay. Welcome, Celia. We see you. Welcome, Maggie. Okay, we're going to get started. Let me see. Okay, welcome everybody. I'm Kathy Beveridge. I'm the current president of the board of the Bucks County Women's Advocacy Coalition. I want you to be aware we are recording this conversation and we'll be posting it to our website later. Luckily, my role as president of the coalition does not involve major decisions like some leaders are facing today. Decisions about the best way to get virus testing to people to limit the spread of the global pandemic, or even decisions about how best to get food to hungry children who are out of school. The biggest decision I was faced with this week was about whether to hold this conversation. I think there may be some who think we shouldn't have done it. Admittedly, our elected officials are incredibly busy right now, responding to their constituents' calls for information and assistance. Our coalition's partner organizations are busy on the front lines of this situation, providing services to their clients who are most vulnerable in our community. In fact, we lost one of our panelists, Dina Della Ducata, CEO of Family Service Association of Bucks County, for that very reason. We decided to continue. While we are very concerned and certainly distracted, our coalition focus issues related to economic security are critical, and many are brought into stark relief right now. Women and families, especially low-income families, are hurting, and the government is thinking about how best to help. More than ever, we can see that paid sick leave is a very good idea. Paid family leave, absolutely. These solutions are getting a longer look at many levels right now. Our coalition needs to keep educating and advocating to remove systemic barriers to gender equity and economic security. We need to stay focused on all of our issues now more than ever. So we decided to have this conversation. My primary job as coalition president today is to welcome and to thank. On behalf of the board, we are delighted to have you all with us this morning for our first virtual conversation with elected officials, or our Zoom convo. Welcome and thanks to our elected officials who we are expecting today: Congressman Fitzpatrick, Senators Collette and Saniciero, State Representatives Davis, Ferry, Schroeder, Thomas, Allman, and Warren, Commissioners Marseglia, DiGirolamo, and Harvey, and members of your staff. Welcome representatives of the coalition's 44 partner organizations and our individual partners. We have over 300 now, and a bunch of you are participating today. Thank you for boldly going on this adventure with us, our first major online event. Welcome members of the coalition board. Thank you for your commitment to our mission and to hosting this event, in spite of the challenges we're facing, so that our advocacy work can carry on. This might be a good time to say that none of us are all that tech savvy, so we are asking for your patience this morning as we do our best on our Zoom platform that is very new to us. We are trying to make it all look and feel seamless and smooth for you, and we need your understanding in case it doesn't. Now, back to welcoming you. Welcome to members of the press. We're glad you're here listening and participating this morning. Welcome to all who are new to the coalition. We are particularly glad that you're here, and we encourage you to become a partner and get involved. tracking an issue that matters to you, participating on a committee, or planning an event with us. Now, I need to share something with you. I want to thank our sponsors today, AARP of Pennsylvania and Comcast. Thank you. Your generous support underwrites this event and the mission of the coalition to educate and advocate to promote systemic change and achieve gender equity and economic security for all. We couldn't do it without you. For that matter, we're grateful for all of our donors who make our work possible, tracking legislation, communicating vital information, sending action alerts when advocacy is critical, communicating vital information, coordinating efforts like Advocacy Day in early April, another activity that will be going virtual this year. We want all of our supporters to know your gifts make our impact possible. If you like what we do and you want more of this activity, please support us with your gifts. We are a 501c4 organization, which means that your gifts are not tax deductible, but we can do as much advocacy as we want, and that's what we're here for. Please give and get involved in whatever way you would like. Here's some technical notes for you this morning. There will be more of these a little later before we open up the conversation. Hopefully you all received our email yesterday with today's agenda and some supporting materials. That email arrived at 10 a.m. Thursday if you're looking for it now. If you dialed in on the phone this morning, these technical notes won't make much sense to you. You'll be able to listen, but you won't be able to participate by submitting a question, raising your hand, or entering the conversation. We're still very glad you're here. If you have questions for the panelists or for elected officials, or if you would like to make a statement about a particular issue of concern to you, please use the Q&A tool. You should see it in the toolbar at the bottom of the window where you're seeing me now. If you don't see those buttons, move your cursor into the window and they should appear. You can submit questions at any time. We won't start fielding them until after the panelists complete their presentations and our facilitator, former coalition board member Amy Strauss, takes over. If you're having technical difficulties, use the chat tool, not the Q&A tool, to send your questions. Coalition board member Louise McLeod will be monitoring and responding to those questions. Use the raise your hand tool along the same toolbar at the bottom of the window. You can use that to signal that you'd like to get into the conversation, and we will try to get you in. So let's practice. Please raise your hand if you're happy to be Zooming with us this morning. There. Seeing your hands. Thank you. We're happy too. Okay, now I'm going to lower all of your hands and ask you to raise your hand if you're struggling with the feeling disconnected from others during this period of self-quarantine and social distancing. Anybody? You raising your hands? Okay. I know it's almost all of us for sure. Okay. I'm going to do one more thing this morning. There's one more tool that we want to try out. Many of you know that the coalition identified a theme to help communicate our focus and why we're doing what we're doing. We call it the economics of women and work. We contend that when we lift the barriers to women's full participation in the economy, we lift the economy overall and everybody will benefit. I'd like to request your participation in a quick poll. Tell us which of the 8 priorities from our Economics of Women and Work theme graphic is the most important to you. And sorry, folks, you can only choose one, even though we know that all of these are incredibly interrelated. Okay, you're doing it. It looks like we have 83 people on the call right now, and 18 of you have answered the poll. Hopefully you're seeing the opportunity and you're just deliberating over which one to choose. I know it's tough. I'm going to give it a few more seconds. I see some people in the chat wondering if anybody can hear them and celebrating the fact that we can't hear what's going on in the background or them sipping their coffee. That's funny. Okay. I'm going to close the poll. And sharing the results. Hoping you all can see that. Looks like affordable healthcare is winning by a slight margin over affordable childcare and affordable education and training. All incredibly high priorities for this coalition. All right, hopefully you're seeing all of that, and we're in awe of some of these tools that we have at our fingertips today. We're going to stop playing now and return to business. Moving on, we have a panel prepared to provide you some information related to our theme. Barbara Price of AAUW and our coalition board, and Antoinette Krause of FAN are here and ready to go. Before we go to them, we want to begin with a brief presentation of Bucks County Commissioner Chair Diane Marseglia. Amy, can you promote her to a panelist, please? Diane has agreed to provide a quick overview of Bucks County's response to the coronavirus situation. After Commissioner Marseglia speaks, we will have some time to ask her your questions. This is good practice for later this morning. If you have a question, please click on the Q&A box at the bottom of the window where you're seeing this feed and enter your question in the box. Enter it whenever you think of it. Even if you don't want to enter a question, you can look at the questions that other people are entering. And if you think a question of someone else is important, you can click on the little thumbs up icon next to that question and promote it up the line so that it will be asked. Okay, I see you, Diane, and I'm going to unpin myself and we're going to go to you. And you feel free to take it away. Thank you very much.
Kathy, thank you so much for doing this. Watching you, you have such poise and such ability to handle this meeting. And I've never done it before in a group like this, so I hope everybody will just bear with me. So you would ask me to give kind of an update just on the coronavirus and where we are with that in Bucks County, is that correct?
Yes, please.
So, you know, this changes by the minute. At the same time, we have so little information that we can give just because there is no information. This is so new for all of us. So I would encourage everybody to check regularly on the Bucks County website. We are updating information to various portals. I am particularly enthused by two things that are on there. We have a portal specific to economic development and issues businesses are facing. And the second thing is we have some connections for mental health, including if you are feeling isolated, some resources that you can use at home on your computer to check in and do some meditation and some other things to get you through this time. We have 13 cases right now in Bucks County. This is going to increase. As you know, LabCorp, Quest, and some private firms are now beginning to test people. And as that happens, our numbers are going to increase. We have staff, we have the Emergency Operations Center open 24 hours a day. I feel like we have our emergency director and our health director, Dr. Damsker, on about 24 hours a day. We are happy to take questions. You can email them to me, but we all need to hang in this together. And I will say what everybody's already heard, stay in as much as you can. That guarantees your safety. Thank you.
Okay, thank you. We have one question for you from Representative Allman. She says her constituents have asked for the location of COVID-19 cases. The patch has identified one this morning. Can we expect this information from the county?
It has been on the website since last night. All you need to do is go on there and you can check the map. I want everyone to remember that if it was you, you would not want your address given. And so we are going to follow all HIPAA laws and respect for one another. Honestly, I know people are very curious and they want to know, but there are 13 cases right now, and it's not really fair that we would be able to identify these people. Many places, including the state, are not identifying the townships. It does you no good to know where these people are. It does not help. So I encourage everybody to let that go. That's not one thing that's going to keep you safe because, you know, people don't have borders in their townships.
Okay. Ardith is asking how many tests have been done?
You know, I'm not sure how many private tests have not been done. I am thinking the county, in terms of people who have qualified to take the test, I'm thinking it's around 50 now. That doesn't mean people haven't gone through, you know, private or some of the test sites that are opening now.
Okay. Panelists, do any of you have questions for Commissioner Marseglia? Okay. Any other questions from our attendees?
Kathy, can you hear me?
Yes.
I just want to add one more thing. It's interesting how, you know, all of our perceptions of things can get colored by a time like this. In the initial poll that you took, every one of those issues have, you know, tenfold in my mind since we've had this virus. The daycare issue, people without training, people who don't have the savings to be able to weather this storm.
Exactly. They're more important now than ever, and yet our focus is split in so many directions that it's harder even sometimes to get a conversation going about them. I have a couple more questions here. Lori is asking, can people that do not have health insurance get testing?
Yes, you just need to call our health department. The number is also on the website. There are, I think, like 24 people answering calls right now. And so, you know, if they don't answer you right away, they'll call you right back and they will walk you through the process.
Okay. And we're seeing information about drive-through testing sites in Montgomery County. Will Bucks County have drive-through testing sites? Nancy is asking.
We have had them. They've been open for a couple days, but like any other testing, you cannot go to that drive-through testing site unless your primary care physician has suggested and will you know, forward a prescription.
I see, sorry to butt in, I see Annette and Carolyn have their hands up in our participant window. If you have questions, Annette and Carolyn, can you please type them in the Q&A box that should appear if you hover over the bottom panel of the Zoom window?
Okay. Okay, I see that Congressman Fitzpatrick is on the line, and I'm wondering if we should go to him to hear his statement. Commissioner Marseglia, thank you very much. I really appreciate your being on this morning and the good information.
Everybody stay safe.
Yes, and stay with us for the conversation if you can spare the time.
I will.
Amy, will you promote Congressman Fitzpatrick if you can find it to a panelist? How are we doing?
Good, he should be unmuted and we see your video, Congressman.
All right.
Go ahead. Would you like to comment about the virus situation?
Sure. Well, thank you guys for doing this. Kathy, to echo Diane, great job. Welcome to Zoom. I didn't know what Zoom was until this week. So thanks for doing this. And, you know, I have been in touch with Diane. The commissioners are doing a really, really good job. You know, this is, as Diane said, it's uncharted territory for everybody. This is a really, really tough circumstance at a whole host of levels. Literally unprecedented in a whole host of areas. And what we got to do is everyone's got to do the best we can to get our arms around the situation, get past this as quickly as we can, and start the rebuilding. I will just give you an update from the federal side. We're sort of looking at everything in terms of three sort of vectors, if you will. Number one is the healthcare demand side. Number two is the healthcare supply side. And the third is the economic relief. On the healthcare demand side, it's what everybody's been practicing, what you've been seeing nonstop on television regarding distancing, regarding sanitation. That's why we're closing schools, shutting down businesses, and educating people on the virus itself. I think all these are part and parcel to understanding what exactly we're dealing with in terms of the health consequences. What we know about the virus, obviously, this is a very unique, novel, and highly contagious virus. And it's spread mainly through personal contact within 6 feet. You know the symptoms there. And secondly are the countertops. That's what really makes this particularly unique in terms of other viruses, is that it can survive for several days, sometimes up to 4 or 5 days on doorknobs, on elevator buttons, on countertops. tray tables. So in addition to distancing, which is incredibly important, and it's important that everybody actually participate in that, but also constant hand washing, constant cleaning of countertops and whatnot, because that's how we're going to, as everybody's heard, the term flatten the curve. If you look at the other countries that have dealt with this, we've had very different outcomes in a place like, say, South Korea versus Italy. South Korea was able to distance immediately upon recognizing the seriousness of this virus, and they've been able to get ahead of that. We have to do that. That's how we will starve the virus, so to speak. The more time we can elapse without allowing for too much spreading, the weaker the strain gets, the fewer people that get contaminated, and time is on our side. The more time we can buy, we can lower that curve, because the lowering of the curve is relevant to part two of that, which is the healthcare supply side. The healthcare infrastructure in this country does not have in our business model what is known as surge capacity, meaning that they're not prepared from an infrastructure standpoint to deal with a mass influx of unexpected patients. Most ICU beds throughout the country are operating at 70, 80% of capacity in a normal environment. And that's why we're calling on the Army Corps of Engineers, the DoD medic apparatus to help us potentially in that need, where they can provide collateral assistance on the exteriors of medical institutions around the country, set up mass tents, if you will. These are people that are used to in war zones dealing with mass influxes on an unexpected basis of medical needs. So that's going to be on the supply side. We can't build hospitals overnight. What we can do is do everything we can to, on an ancillary basis, expand our medical capacity from an infrastructure standpoint. And then third is the economic piece, and this is what's being debated now. Everybody knows we've had two different iterations thus far that have passed both the House and the Senate and have been signed into law. The big one is what's being weighed in now. I will tell you that I am a big believer, having spoken to many, many employees, many small businesses. I've been on the phone 14 hours a day, literally, with everyone throughout our community, as well as our elected officials, and talking to workers themselves, that I think we can streamline this by targeting certain things. Number one, providing direct and immediate economic relief to workers, mainly lower to middle income class workers that are hourly employees, tip wage earners, and the like, the people that are really struggling financially right now. They're the ones that need our direct economic assistance. And second, when it comes to the small businesses, if we can work with the insurance companies, either legislatively or through otherwise, contractual agreements, to allow them to allow business interruption coverage to expand to pandemics. Currently, it does not, and that's the big problem that all of our businesses are facing right now. Any other business interruption, whether it be a fire or a flood or whatnot, is covered by insurance. It allows those small businesses to not lay off employees, to continue paying them. So if we had that provision coupled with paid family medical leave and paid sick leave, which were both contained in the bill, bill number 2, that has been signed into law, that's sort of the direct targeted economic benefits that I think we need to get to our workers that are living paycheck to paycheck. So those are the 3 big buckets. I don't want to spend a lot of time talking. If any of your participants have questions, I'm happy to answer them.
Okay. I don't see any questions in the Q&A box. Do any of the panelists want to ask a question of the Congressman? Oh, here are some questions. Ada is asking, instead of sending funds directly to individuals, would it be more effective to send those funds to the agencies assisting the individuals or directly to the states? Would you like
all
to
the
respond?
above. Yeah, all the above. And that's where we need our state and local elected officials to weigh in. We need our governors to weigh in, because our job is to provide the funding, and then number 2, provide the discretion for state and local governments to use that funding in the way they see fit. However, a big piece of this must be direct, targeted economic benefits to the workers, because with every additional layer of government, with every additional agency that's got to serve as a pass-through, it causes a delay in time for a very time-sensitive situation right now. I also think that a part of this has to be dealing with a lot of the debt holders, whether they be mortgage companies, utility companies, anybody that, the recurring monthly payments, to be able to provide a 30-day advance at minimum, just to allow people to relieve that financial stress. That coupled with a direct cash infusion to the targeted audience that we're trying to get it to, which are the people that are really in financial distress right now, hourly employees, tip wage earners, people that have been laid off from their jobs that are living paycheck to paycheck. What our job now, and this has got to be a community effort, and anybody who has any input, please reach out to all of us, reach out to myself, reach out to your state and county officials, and provide your input, because this has got to be a community effort. There's no one person that's got a monopoly on all the answers right now. This is a brand new circumstance. We need everybody's input to try to come up with the best product.
Okay. Penny Ettinger from NOVA, one of our nonprofit organizations, is asking, will nonprofits be included in the category of small business loans?
They should be, and I'm advocating for it. So that's one of the pieces that we're going to be advocating for today, because the small businesses are important, that they maintain their employees, but we have a lot of nonprofits that have employees that they have to pay as well.
Absolutely. And they're
so
stretched right now.
They absolutely are, and they're critical. They're critical to us getting through this.
Mm-hmm. Okay. We have some other questions. Not sure if you might have answered them already. SEMA would like you to clarify, under the newly passed federal law, which employers are mandated to provide paid sick leave.
So under version 2, and it's important we clarify this because we're about to buttress this with the much more significant and longer term version 3, economic package number 3. 1 and 2 were basically stopgap measures to stop the bleeding, at least on a short-term basis. The original provisions were for small businesses, so businesses that have 500 or fewer employees, to provide, number 1, paid family sick leave, and also, paid family medical leave and sick leave for a minimum of 2 weeks. Again, with the intent of us going back and revisiting the broader package, but just to get us through that first 2-week period.
Okay. And what is being done to speed protective equipment to our health workers, particularly in hospital ERs? Can you comment on that?
Yeah, so a couple of things. You heard basically the invocation of what's a Wartime Declaration Act, which allows the administrative branch of government to work with the private sector, work with manufacturing companies to expand capacity. So for example, 3M is basically upping their production of protective equipment, mainly safety masks, by 50 to 75%. So what I said as far as vector or bucket 2 of this is the healthcare supply side. That includes not just ICU beds, not just ventilators, it includes protective equipment. It includes masks, goggles, headgear, gowns, everything that we need to keep our healthcare workers safe as well. Because keep in mind, as Diane said, this is a ripple effect. We're seeing a lot of that. We have to keep our healthcare workers healthy. We have to keep the insides of our medical institutions clean, because they are the battleships in this fight. If we start having problems there, we got bigger problems. And moreover, it's good that the parents and the kids are home together now. But for the essential employees, the healthcare workers, the police officers, the firefighters, the medics that are essential employees, we have to be cognizant of their child care needs and working to deregulate the state licensed child care facilities to allow them to reopen, to at least be able to accommodate the children of our essential employees.
Okay, thank you very much. I know this is a really important topic, and we are not doing it justice, but we do want to keep going with our program, and hopefully we'll come back to some of these questions if we need to later in the morning. So thank you very much, Congressman and Commissioner Seglia, and please stay with us if you can for some additional discussion later. Now I'd like to introduce Marcia Telhorster. Marcia has been serving as our very capable Coalition Executive Director while we're piloting a new structure for the organization. She is a member of the Coalition Board of Directors, and she is going to introduce our panelists this morning. Marcia.
Kathy, am I on now? Yay.
You are on.
Well, we have 2 panelists, as you mentioned earlier. Dina Della Ducata from Family Service Association of Bucks County is dealing right now with things related to the coronavirus, so she's not able to join us today. But I would like to introduce Antoinette Kraus, who is with the Pennsylvania Health Access Network, or FAN. Antoinette is the founding executive director of FAN, which is Pennsylvania's only statewide health advocacy organization working to expand and protect access to high quality, equitable, affordable healthcare for all Pennsylvanians. At FAN, Antoinette has led campaigns to expand Medicare, protect seniors' access to care, defend the Affordable Care Act, Medicaid, and CHIP, and most recently, push for a solution to soaring prescription drug costs. Before coming to FAN in 2008, Antoinette held numerous positions in both grassroots and political campaigns and has extensive experience as a community organizer. And if any of you have seen any of the promotional materials or the informational materials rather that she has sent out from FAN recently, you can see that her passion is really working on these issues for people in Pennsylvania. So we welcome Antoinette. I would also like to introduce Barbara Price of the AAUW. Barbara has been an active AAUW member for 45 years. Of course, she began when she was 12, serving in various leadership positions at the state and local level, including state president. Currently, she is public policy chair at AAUW PA and also serves on the national AAUW Public Policy Committee. She is vice president of the Bucks County Women's Advocacy Coalition and chairs the Jobs and Education Committee. Barbara was executive director for 20 years of the New Jersey Coalition to End Domestic Violence. When I was interviewing Barbara for this particular piece here, she told me about her early advocacy days working very hard to get important things for college students in her college. Things like toilet paper was not available on the weekend. So she was one of the people that was raising her hand and taking the issue up the chain where it needed to be. And I just thought that was so timely for today, given our certain shortages, given this virus that we're dealing with. So Barbara, you were an early advocate, and we appreciate you being on our panel today. We're going to start with Antoinette, then we're going to go to Barbara. And as Kathy indicated already, you can ask your questions through the Q&A function at the bottom. Antoinette, would you like to start?
Yep. Can folks hear me? I muted everything that I had so people couldn't hear kids and cats and life going on in the background. But first, I want to thank the Bucks County Women's Advocacy Coalition for hosting this conversation. I know we're in trying times, but I think it's important to stay connected. And now more than ever, we need to be focused on how do we strengthen the social safety net and improve access to quality, affordable health care. So our organization is a statewide advocacy organization. You know, our main mission is to make sure everyone has quality, affordable health care. But we also operate a statewide helpline. So we provide direct enrollment assistance for Medicaid, CHIP, and the Affordable Care Act. And I just wanted to let folks know that our helpline is still operating and folks should use that as a resource. Our number is 877-570-3642 and then 877-570-3642. Our enrollment team is there to help folks understand, you know, what benefits they may be eligible for if you are losing employment due to this crisis, or you know, you need to file for unemployment, you need access to health insurance, you now may be eligible for SNAP. So we encourage folks, you know, if people have any sorts of questions, to call our helpline. We're up and running. You know, I think my presentation would have been a little bit different a couple days ago, but I think this crisis really exemplifies kind of the fragmented, broken pieces of our healthcare system. You know, we recognize and applaud public officials at all levels of government, you know, for making testing available and free without co-pays, co-insurance, or deductibles, and making sure anyone that's uninsured could get a test. We heard President Trump recently say, you know, no American should receive a surprise medical bill while being treated for COVID-19. So, you know, we think that's important, and we're glad that our elected officials are recognizing the flaws in our healthcare system. But we need to also understand that people's general health needs, testing, you know, for cancer and all of that stuff will go on, and no one should receive a surprise medical bill or be worried about affording healthcare coverage. Last year, we worked with Alterum, funded through Robert Wood Johnson Foundation, to do polling across Pennsylvania. So I'm just going to give you a quick sense of what we found. And for most folks on the call, this is probably not a surprise. For many of us, it's the reality of our healthcare system. Last year, we know that 1 in 2 Pennsylvanians struggled to afford healthcare. 4 in 5 worried that they'd not be able to pay for healthcare in the future. Across party lines, 3 in 4 Pennsylvanians want direct action to address rising healthcare costs. We know that 1 in 3 Pennsylvanians receive a surprise medical bill every year, and that one of the biggest concerns is the rising cost of prescription drugs. So 1 in 5 Pennsylvanians chose not to refill a prescription due to cost. Another 1 in 6 skipped doses or cut pills in half, and 2 in 3 Pennsylvanians were worried about the cost of prescription drugs in the future. So we see tremendous opportunity, and our policy agenda for the past 2 years has really been to do a couple things. So that is end the practice of surprise medical bills. So we are supporting House Bill 1862, which is in Harrisburg right now, that would end surprise medical bill practices in Pennsylvania. We've also worked very hard to get legislation introduced in Pennsylvania to curb the rising cost of prescription drugs. So we are supporting the Prescription Drug Affordability Act, which is an important piece of legislation that would set up an independent advisory board to look at the cost of prescription drugs and be able to rein in out of control drug prices. So, both of those bills are introduced in the House, and we're encouraging folks to continue to take action on them. Because of the changing times, we're also looking at what are the federal advocacy pieces that we need to do right now in light of this virus. So we're also asking folks to reach out to their senators at the federal level, so Senator Casey and Senator Toomey, and ask them to support opening up the special enrollment period for the Affordable Care Act. So right now you can enroll in ACA coverage for a life change. So if you lose your job, you have a child, something changes in your household, we want them to open it up to special enrollment period for anyone that's uninsured, so they could get coverage right now through the Affordable Care Act if they're eligible. And we're also encouraging Senator Casey and Senator Toomey to support efforts to raise the Medicaid matching rate by 10% for states. They often do this in times of crisis to help support states' Medicaid program, because we know more folks will need Medicaid. It's a big piece of the state budget, and those extra dollars towards the Medicaid program will go a long way to help folks. So I know we're going to have more of a discussion, so we can talk more about the various pieces of legislation and answer questions. So I'll stop there. Kathleen, I think you're muted.
Sorry, go ahead, Barbara. Talking to myself, I apologize.
Those are always good conversations to have, though. So, since 1881, when the American Association of University Women, AAUW, was founded, the mission has been the advancement of women in education, and we've made great progress. Women are now the majority of students in college in the United States, and students from a variety of racial and ethnic backgrounds are much better represented on campus. But while college has become a more diverse place, it has also become more expensive. Since 1887, there has been a 103% increase in the price of a college education, while median household income has only increased 14%. As a result, student loans are filling the gap. Americans now owe $1.46 trillion in student loan debt, the second largest category of debt in the United States, second only to home mortgages. While many people are talking about the challenges associated with student loan debt, few people have examined the role of gender and race in how much debt students take on. Women actually hold almost 2/3 of student loan debt, or about $964 billion. AUW's research report Deeper in Debt showed that on average, women completing undergraduate degrees or certificates take on about $1,500 to $1,900 more dollars in student loan debt than men. Breaking down the average debt of students graduating with a bachelor's degree by both gender and race shows substantial differences. Though women overall tend to have more debt than men, Black and Hispanic graduates have even higher debt. Black women actually have the largest average debt of any group of bachelor's degree graduates. Most studies and data focus on students who graduate, but many college students actually never complete an academic program. Those who leave college without a degree may still have student loan debt, but without the increased earnings potential that comes with a degree. These students are much more likely to default on their loans than students who graduate. Other risk factors for student loan default are having a lower income or family income while enrolled and being a single parent. Women make up 71% of all student parents, married and single, and 43% of these mothers are single mothers. For both women and men, possessing a college degree is associated with much higher pay. However, women graduate to an immediate 7% wage gap with men. As the wage gap continues, and it's 23% here in Bucks County, it means less income to devote to debt repayment. In the time period between 1 and 4 years after graduation, men paid off an average of 38% of their student debt, while women paid off only 31%. Women take about 2 years longer than men to repay student loans and are more likely to struggle economically as they do so. 57% of Black women and 42% of Hispanic women report financial difficulties while repaying student loans, such as being able to afford all essential expenses sometime in the past year. A major contributing factor to student loan debt is the high cost of a college education. Students attend a variety of institutions, however. Most students actually attend public institutions, such as community colleges and four-year institutions offering bachelor's and graduate degrees. Tuition and fees at Pennsylvania's public colleges have gone up 66% since 2001 after adjusting for inflation. These rising costs have resulted in a decline in attendance of low and middle income students and a crushing amount of debt for those who do attend. In fact, Lend EDU ranked Pennsylvania #1 in the nation for highest student debt. Tuition goes up because of our state's low support for public higher education. Since 2000, state funding is down by 25% in inflation-adjusted dollars. Pennsylvania ranks 47th out of 50 states for per capita investments in higher education. And there's no increase in the governor's 2021 budget for the state system of higher education. Tuition and fees now account for nearly 3/4, 73% of educational costs at the Pennsylvania state system schools, compared to half that level, 37% in 1983-84. Total costs have gone from 1/5 of median family income to over 1/3. Let's look at how this affects one particular young woman, a 24-year-old from Northeast Philadelphia with a college degree in biochemistry, a STEM field, and exactly the job she wanted as a hospital lab technician. However, she's forced to live at home with her parents, middle-class retirees, and has no idea when she'll ever be able to get a place of her own because of her student debt, a whopping $130,000. She is paying 12% interest on the Sallie Mae student loan that financed her tuition. Even after renegotiating the monthly payments down to $600 a month, which basically just covers the interest, she's having difficulty paying her other expenses in spite of living with her parents. So what can we do about this? At the federal level, we need to increase funding for Pell Grants. The vast majority of Pell Grant students come from families making $40,000 or less. We need to make income-driven repayment plans and refinancing options easier to access and less confusing. And we should make student loans more easily discharged through bankruptcy. At the state level, we need to increase funding for higher education. We should support the Nellie Bly scholarships the governor proposed in his budget to cover the gap between Pell Grants and college costs. And we should support the PA Promise Act in both the House and Senate to provide 2 years of free tuition at the state's 14 community colleges, where students' families earn less than $110,000 a year, with additional support where families earn less than $40,000. For further information, you can read the white paper from the Bucks County Women's Advocacy Coalition Post-Secondary Education Committee, The Crisis of Affordability in Post-Secondary Education in America. What is the pathway forward? You can find the white paper on our website. In this election year, the Bucks County Women's Advocacy Coalition wanted our conversation with elected officials to focus a bit more in depth on issues that are of concern to our partners. We will be listening for candidates' approach to these topics. This year also marks the 100th anniversary of the 19th Amendment securing women the right to vote, and the 55th anniversary of the Voting Rights Act of 1965 that finally ensured the right to vote for women of color. As we celebrate these milestones and the women and men who fought long and hard to achieve them, we want to encourage everyone to participate in the civic life of our country by voting. It is much easier now with some of the Pennsylvania voting reforms. If you are concerned about voting in person because of the coronavirus, you can now vote by mail without needing an excuse. Go to votespa.com to get information on how to request a mail-in ballot. Your vote this year will honor those persistent women who never gave up on getting the right to have their voices heard. Thank you.
Okay. Thank you very much, Barbara and Dwynette. I'm sorry my thanks to you was not heard because I was on mute. But we really do appreciate our panelists, and we're seeing your questions for the panelists. We're going to come back to them in a minute, I promise. I first want to introduce Amy Strauss. Amy is a former coalition board member who was such a capable convo facilitator last year that we asked her to come back and do it again. She will go over some of our rules of engagement and remind you of the technical procedures. Okay, Amy?
Okay, can everyone see and hear me? I guess I won't know if you can't, but I will go ahead and remind you of some of the functionality that we have here in the virtual Zoom convo, and have a couple of ground rules to remind you of. But before we get started with the conversation portion of the morning, I want to highlight the extraordinary effort made by Kathy, Marcia, Nancy, and the rest of the Conversation Planning Committee in putting this event together in the first place, and then in making the early decision to switch to a virtual meeting in the interest of our community's health. They got spun up on this technology incredibly quickly and did an incredible amount of planning behind the scenes to make sure this would still be a valuable conversation. What we have practiced and outlined are some ways to try to make this feel, a tenth as dynamic as our conversation usually feels. And so I have some functionality that I will be adding to this conversation to get more of you in terms of voices. There are a few ground rules from our normal conversation, which we ask you to respect. First of all, please keep your comment or question to 2 minutes so that we can hear lots of voices. Please stay on topic and remember that we're here to listen to different perspectives. So this is more relevant when we're live, but also please do not engage in any back and forth debate. Here we actually have the mute power, so it's not just me stealing the microphone from you. I also want to remind everyone that the Bucks County Women's Advocacy Coalition is a nonpartisan organization. We host this event every year to share ideas and to engage the elected officials in conversation. One other thing to keep in mind is there are reporters from various news organizations joining us in our conversation today, so be mindful. And please also know that we are recording this webinar and we plan to post this to our website and social media later for those that were not able to join us. So wanted to be sure you all were aware of that as well. So a few virtual Zoom edition reminders. If you dialed in by phone, you'll be able to listen, and we hope that you get a lot of value out of this. Hopefully you can engage in some question and answer on social media after we do post this. If you use Zoom, we can see your name, so we can recognize you to ask your question. So if you can see make sure that you have the Q&A panel enabled at the bottom of your screen. Just to remind you, hover your mouse over the bottom of the Zoom window, and then the Q&A panel will pop up. I also encourage you to upvote questions that you think are valuable, because that pulls it to the top of our screens, so we are more likely to see it and be able to address it. If you can, please indicate the overall topic of your question and to whom the question is directed, because once we start getting a lot of questions going, it's difficult for us to skim big blocks of text. Please also be sure you are typing in the Q&A window as opposed to the chat, but so far everybody's been doing great with that. The chat is for technical questions that Louise McLeod can help you with. Let's see, what else needs to be said? Right now, you are all in what's called attendee status, so we cannot see or hear you. When I get to your question, instead of continuing to hear my voice, I'm going to do my best to actually promote the question asker to a panelist mode. And if you have your video enabled, we'll be able to see and hear you. If you don't want your video enabled, that's fine. Nobody has to go pick up their bedroom or put on makeup, but you can just make sure not to enable your video. So when I promote you to a panelist, I may request video, just say no, and please give us your question in audio format. We would love to be able to see all of you, though, to kind of create that dynamism that we normally have in the conversation. Elected officials and elected official staffers, if you would like to respond or comment to something you are hearing, please use the raise your hand function in the attendee window. That way, I'll be able to go to you to respond to any of the issues that we're talking about. I'm not sure if anybody's interested in this. You can change the arrangement of the speakers. Right now, most of you are probably in speaker view, and so your window will be flashing back and forth between the people who are speaking. If you'd like to see more gallery view, you can change that in the upper right of your panel. If you have any questions about Zoom or you're having troubles, please, like we said, either use the chat function or email Lindsay Britt at lbritt@bcwac.org. I'm going to repeat this to write it down, lbritt@bcwac.org. We do hope you enjoy this conversation, and particularly if you're new to the coalition, we hope to be able to meet you in person and even shake your hand sometime soon. So with that, let's get started. I have a question here from Tina Davis that a lot of people are interested in, Antoinette, regarding the health coverage due to closings of different organizations. I'm going to try to go to her audio, but she may be having technical difficulties, and I'll just read her question if so. So Tina, if you can hear us, I've unmuted you. Can you ask your question?
Can you hear me?
Yes, we can. Hi, Tina.
Oh, we're getting a lot of calls from people whose companies are closing down and they are not going to have health insurance. So should we advise them to apply for temporary Affordable Care Act coverage, or what should we do?
Yeah, so absolutely. If you are losing healthcare coverage because your business is temporarily shutting down, you might be eligible for the Affordable Care Act. That constitutes a special enrollment period. In some cases, folks might even apply for Medicaid coverage. Medicaid is point in time and not always annualized. So you might be eligible for Medicaid as well. Folks can go to healthcare.gov to start that process. Also, for Medicaid applications, they can go to Compass, which is the state website. All of the county assistance offices are currently closed to in-person walk-in appointments, so we encourage folks to really use Compass to go online. Folks also might be eligible for other benefits besides health insurance coverage. And again, we run a statewide helpline, so our number is 877-570-3642. So our navigators can help folks figure out what they might be eligible for and walk them through the process. And we're a community partner as well for Medicaid, so we can also help people apply directly through Compass. So yes, everyone should figure out if they're eligible for benefits, but if they're losing coverage, they would be eligible for something.
Thank you, Antoinette. We're seeing a question here from Elizabeth Downing. Elizabeth, I'm going to promote you to attendee or panelist status so you can ask your question. Sorry, this takes us a minute, everyone. Elizabeth, we can hear you now if you talk.
Okay, hi everybody.
Hi.
Good to talk to all of you. I kind of have a rhetorical question, which is how can we encourage what some of our presidential candidates have stated in the past, which is that we should talk about forgiving student loan debt. Most of the presidential candidates these days, and this is sort of a rhetorical question for Barbara, but for anybody else who is interested, as some of you know, I've been involved in this question for a while, and I think we need to elevate its status in the presidential debate because such a huge proportion of our young people are struggling, as Barbara pointed out, with the individuals she mentioned, and so many of our local people that are basically lifelong, spending their lives paying off student debt, which should not be the case.
Thank you. Go ahead, Barbara.
Right, I agree. And everybody should know that Elizabeth Downing is the chair of our post-secondary education committee and has done yeoman's work in managing this white paper that we've developed, which is a compilation of a lot of research, building on the AAW research, but other research that has been done. Yeah, it would be great if we could figure out a way to do some kind of forgiveness to student loans. They are a problem, and we just need to keep encouraging our leaders to deal with this issue.
I know you wouldn't have an answer, but I was trying to just say we need to elevate that conversation somehow.
Right, absolutely.
Thanks very much. I'm going to go now to State Representative Wendy Allman. Wendy, I see a couple profiles here from you, so I'm going to pick one. If this is not you, we'll deal with that. Hold on 1 minute, folks. Hi, Wendy, we can hear you now. Oh, actually, I think that's not a profile that has audio. Let me try the other one. Thank you guys for bearing with us as we engage in this experiment. Okay. Wendy, can you talk?
I can talk. Can you hear?
We can. I asked to start video. If you're in a place you'd like to do that, go ahead.
Okay, we're good. So I'm really concerned that we give the very best advice about making sure that community mental health support, particularly our professionals. I know that we've made some measures relative to telemedicine, but I think that continuity of support for mental health concerns is going to be a critical care need, and I want to make sure that we're offering the very best support as we try to address this legislatively.
Antoinette, do you want to respond to that? Or actually, I could ask Diane Marseglia if she's still here, if she has a response about community mental health support. Hold on. Oh, shoot.
I'm here.
Oh, hi, Diane.
Hi, how are you? Was that with regard to the current situation or overall?
The current situation, I think, is the crisis point. I think that we're pretty well sorted out as far as what life looked like 2 weeks ago, but now we have to be prepared for the next 2 weeks, 2 months, and this is a critical component. So I really appreciate any guidance you can offer.
So I've noticed that, you know, Magellan, if you are associated with Medicare or Medicaid, is now accepting telehealth for counseling, therapy appointments and whatnot. And now most of the commercial insurances are accepting mental health. So you can do it by telephone or by Zoom or by Doxy, one of the professional services that are out there. It's amazing how fast that actually has gotten through, so that's helpful. It just goes to show that when we need to move something on the mental health spectrum, we can move it. We do have, again, on the county website, some options. If you are having an addiction problem, we are still helping people to get into treatment. We are still helping people to get into a hospital if they need to. Our crisis workers are still answering calls. We have an extra line that's being funneled to county employees in the mental health department. So, you know, we're doing the best we can. We're gonna have to work and do as much as we can home-based.
Thank you, Diane.
Thank you both. I'm going to go now to a question from Celia Sharp about AAUW and their plans for disruption in the educational process. Let me find you here, Celia.
I can just add, if Amy is calling on you and she's looking for you, if you raise your hand, it'll make your profile go right to the top, and that'll make it easier for her to find. So Celia, if you can raise your hand, that might help.
And I did find Celia. You're off mute now, so go ahead, Celia, with your question.
I am concerned about the present situation with the cancellation of the school years all across. What do we need to be prepared for to help the families and the students during this situation?
Do either of our panelists have a comment on that? Or I'll also see, I see State Representative Thomas will add on after you guys go.
This is Barbara. I don't know, you know, students are going to need the same kinds of support that we've been talking about, you know, if their parents, if they can't be on their parents' health insurance or their parents lose health insurance, that's going to be another issue for them. Again, you know, the student loan piece, if there would be a way to forgive their non-payment of their student loan post-graduation. And then, you know, they're going to need other supports, especially there are a lot of students who go to college who really, they're on food stamps or they don't have enough to eat. So there's lots of things and supports that they needed in college that are going to just be exacerbated by this situation, I think. And so they'll have to look to all the other support systems that we do have, which then will be overwhelmed. But, you know, again, we all have to step up and do what we can in this situation.
Representative Thomas? Oh, go ahead, Antoinette, sorry.
Oh, I was just gonna add, you know, I think that this really underlines the vulnerability of our safety net. Mm-hmm. And we are going to all have to work together. And that's why I'm so energized by this conversation today, both, you know, that elected officials are participating and community leaders, because we're gonna have to think long and hard after this is done to address the vulnerabilities that we found in the social safety net, and also strengthen a lot of the areas, you know, paid sick days, childcare, education, you know, not just healthcare. So I think, you know, we all need to continue to band together to advocate for what folks are going to need in our communities.
Go ahead, Representative Thomas. Did you want to add on to that?
I just wanted to say, can you hear me?
Yeah.
Sorry. I just wanted to say that there are a number of questions surrounding education, and we are headed to Harrisburg on Monday, and I know the education bill is one of them. I don't think any of us know right now how long at least K-12 will be out. Obviously, higher education, most of them have gone to remote learning, but we've heard loud and clear that we need to allow the schools to remote learn where they can with what students they can. They also have to be able to help all of their students, and so we're going to have to help them do that. But please know that we're concerned, and we know this is a big question with the education. Thank you.
Sticking with that theme of education, I see a couple questions that I'm going to take the liberty to blend together. One regarding the community college and one regarding below university training or other than college education training. Barbara, I know AAUW is largely focused on university level education, but do you have any comment on the this idea of considering more vocational technical education. And I'm going to promote Monica Wenninger to add to the conversation here.
Yes, the Bucks County Women's Advocacy Coalition Post-Secondary Education Committee is focused on anything that's post-secondary. And obviously, there are lots of other means of getting a post-secondary education, but it's almost a necessity these days. Even if you go to some of these technical centers to get, very technical education, even if that's like a 2-year program or whatever. The other problem that has occurred is that some of those places that offer this kind of other than a college education are private institutions that have really charged people a fortune and have in some instances cost students a lot of money in loans. There's a young woman in Langhorne, in fact, who went to a local institution that was certified for student loans, but not for the program she went to, and she did not know that. She was learning to be a sonogram technician, and she graduated, and she now owes $36,000 in student debt, and she can't get a job because the program she went to is not certified, so no one will hire her in that. So those are the other issues that we need to look at, especially in post-secondary education that promotes technical issues, especially if they are going to offer student loans, that it is a certified program.
And Antoinette, did you want to add to that?
Yeah, sorry. So I think the other interesting piece that we are not touching on as much is the impact on pre-K and daycare. So I think we have heard from a lot of individuals, my daughter is in pre-K and we got a scary email from our daycare center that says, we're good for the next 2 weeks, but after that, we're going to have to lay off staff and we can't guarantee that when this is over, that our center will be able to open again. And I know, we participated in a call with PCCY, but I think there's a big strain on daycare providers and childcare centers as well, who, live kind of day by day and, require that income. We know the state has done some to make sure that folks that are getting childcare payments for low-income kids will still get those payments, but I think there's also another subset of early education that serves kind of the middle class dynamic that's struggling right now. So I think that's another thing we want to look at as we think about education.
Monica, do you want to add to your question? And then I have Representative Allman dialed back in here to maybe catch us up on what's happening at the state level on these issues. Go ahead, Monica.
Hello. Right, because I'm a public school teacher, hence why I'm home today, teach in the Montgomery County School District. And we've been surprised as a public school teacher, the emphasis has always been on college. It's always been promoting college. I'm a 7th grade teacher. Even in the middle school, we were promoting college. And there seems to have been a change in the past year or so to other pathways, such as VOTEC schools. And I know that there's always been that stigma to VOTEC education, and it's really been changing. I know Montgomery has excellent tech school as well as Bucks County here. So there seems to be kind of a change, and there's excellent programs there at the VOTEC. It's not just, car mechanics, that's what we tend to think of. The biotechnology, there's a lot of great programs out there. So I think we really have to start thinking outside the box to these non-traditional programs. And I think it goes back, we have to set these kids up for success in high school and public education. We really have to start thinking about preparing kids in high school already for these programs, more AP classes, more non-traditional learning. So kids can, for instance, earn college credit while still in high school. So I just think we really have to keep an open mind and start thinking of other avenues.
Thank you so much, Monica. Representative Allman, I know that was a lot of information that we just heard. Do you want to respond to any of it or add to the conversation?
I just wanted to give you some quick information. I'm a former community college teacher and I'm on the Public Higher Education Funding Commission. So this is part of what we've been talking about in discussion in Harrisburg. For the community college component and the non-traditional avenues, there's a huge growing support for what is called middle skills at the post-secondary level, where you have interlocking groups of information which you can be connected to, which are basically skills oriented so that you become certified. So these are essentially interlocking certificate programs, which may be between 8 weeks, 6 weeks, 20 weeks, but then at the end of them, you are given a certificate, which makes you qualified for something. This is something that the public schools can do through our regulation processes, and many people are taking advantage of it. I also wanted to talk about a program that it's a bill I was ready to drop, which at this point I will not do because we have things which are far more pressing, which was essentially a streamlined articulation program between community colleges and the PASHE system, so that you could take 60 credits and transfer guaranteed all credits into one of the PASHE universities, thus reducing the time it takes to graduate and ensuring that your major credits transfer. But these are some of the issues that can reduce overall cost of education and overall time spent getting an education and ending up with skills that actually get you a useful job.
Thank you. And while I have Representative Allman here, I'm going to actually ask Dan O'Brien to ask his question. And I do see you, Lydia. It's a little bit of a different topic, so I'm going to come back around to that. But Dan, since your question was regarding a state level issue, oop, there we go. Why don't you go ahead and ask your question now? Thanks. Hi.
Hi, how are you? Can you hear me?
A little bit of an echo.
Okay. Really, what I was, can you hear me any better now?
A little bit. Go ahead.
Okay. It was kind of briefly mentioned, but I really curious. You know, I work for BCWAC, and we had a call with over 100 child care providers in the area talking about the issues they were facing. And has there been any discussion at the state level about emergency funds to ensure that these providers are not going to have to shut down after a long-term layoff? It's going to be a real problem throughout the state, but especially here in Bucks County and the rest of the Philadelphia region.
Thanks, Dan. Go ahead. Oh, sorry. Right as you take some of your breakfast, Wendy, I'm coming back to you to see if you have any update on whether there's any state action for the issues Dan's raising regarding child care providers.
I do not have information on that. That's a question that I'm hoping to hear some information on this morning.
Okay, great. Thanks, Dan. We'll do Barbara or Antoinette, have either of you heard through your networks if that's something that's being considered?
Well, I thought I heard that they closed down all the daycares today.
Yeah. I mean, they definitely did. That's part of the governor's executive order. I think the question remains what happens after the shutdown process, right? Some will be able to reopen, some may not. And you know, people have had to wait in some cases years to get into their daycares, right? So we're going to have a daycare shortage. So I think it's something that really needs to be front of mind as we also think about education moving forward.
Thank you.
A major issue for mothers attending school in any case is having daycare. And in fact, some Bucks County Community College actually does offer daycare, and that's wonderful. Not all community colleges do that, and not all universities do that. So that's and now with a lot of the universities being shut down, that's not available either. But it is something that we need to think about in terms of where do we go from here? If people can't get daycare, they can't work.
I'm going to see State Representative Davis has something to add to this conversation if I can promote her. There we go. All right, go ahead, Tina, you're on. Oh, wait, no, you're not. Now you are.
I was just on the phone with Jeff Darwick regarding the business loans that they offer to different groups. Next week, there's going to be a very big phone call with all the Bucks County economic development groups on how to infuse money into some of these businesses Currently, you can apply for a disaster relief through the government, through the federal government. I was actually just going through it this morning to see how easy it was, and it's fairly easy. So just wanted to add that.
Great. Great.
Thank you.
All right, I think the next question is coming for you, Diane Marseglia. I'm going to ask Lydia to ask her question, and I know she has asked it at least last year and perhaps many years going back. Hold on just a second, Lydia. All right, now you're off mute. Go ahead with your question. Thank you.
My question is for any of the county commissioners, and Diane, of course, we've worked together before. Funding for the community college has never been at the level that it's supposed to be in several years, from our own county to our own county community college. Is there any effort underway to really restore the amount of money that the community college is supposed to receive, as opposed to having it passed on to the students as increased tuition costs? And additionally, once again, for women, there are states, there are programs where there is free daycare being offered. That would be an incentive that would allow more women and men to follow through with their education and be safe about where their children are placed.
Hi, I'll go briefly, and then if Jean or Bob's on, they can take a chance at this. So we have been agreeing that we would like to try to get, our share up to the 33% that was committed in the early season. I'm wondering about, and have said this before, about the possibility of a referendum on this to make sure that we have community support, and I think we would. There's a lot of support in Bucks County for that. To be honest with you, we did talk about it in the beginning of our term. We haven't been there 90 days yet, and then this virus happened, and we've become all virus all the time. Bob?
Not
both
sure.
Bob, both our other commissioners should now be on video and unmuted, so feel free to take this one on, gentlemen.
Thank you, Amy, and I echo your thanks to everybody who's putting this on, and all the panelists and the leadership of the Women's Advocacy Coalition putting this all together. Yeah, we've had a couple conversations. Interestingly, the young man who's president of the student body, I've had a meeting with him here a couple weeks ago. He was concerned about funding. It has been flat. It's been about, I think it's $14 million every year. That's obviously something that we are looking at. As Diane said, we do have part of our plan coming in, and Kathy Beveridge and Amy know this very well, that we do have several transition committees which are studying different aspects of county business, county life, and they're going to be giving us some recommendations. One of those is a budget and finance committee. They started meeting first in December. And they've given us, as all the committees so far have given us, a few things that we can be focusing on. And so once we get a good handle on finances, which we're hoping we can keep a handle on, given how much we've been spending and going to be spending for the next several months, we're going to have a better idea of what we can do financially. But Diane and I have talked about this for a while. My background in education obviously makes it critically important to me as well. So yeah, everything's on the table right now.
Hi, Amy. Jean DiGirolamo.
Hello.
How you doing, Amy?
Good. I'm sorry we have the wrong name here. I think if links were forwarded, then your actual name did not get entered. So for everyone watching at home, this is not also Bob Harvey. This is one of our other new commissioners, Jean DiGirolamo.
How you doing, everybody? Good morning. Good to be with you. I want to thank the coalition for doing this today. And Antoinette, good to see you as well. We've worked on a lot of issues dealing with healthcare. When it comes to the community college, I was part of a forum before the election at the community college with students and teachers and administration. And that was the one issue that they brought up, the funding for the community college from the county. And, I think both of the other commissioners agrees it's something that we're going to look at. I think it's something that's really important. It's Hopefully we can figure a way out to put more money into the community college. They just do a terrific job with our young people and are certainly deserving. So you got my promise to take a really hard look at it as we go through the budget and through this year to try to get some more money in. Amy, could I change gears and just touch on a different subject? Because I'm going to have to be off at 10. Would that be okay?
Sure.
For just 2 minutes? And again, Antoinette Krause, I mean, we've worked, and the issue is healthcare. And especially with what we're going through and what we're going to be going through with this coronavirus issue. And my big concern is with the Medicaid. And that part of the healthcare is critically important. In Bucks County right now, I believe there's at least 75,000 people in Bucks County that are on Medicaid, the traditional and the expanded Medicaid. And I want to throw the question out there. I mean, where would we be at now if 2 years ago, John McCain didn't stand in the well of the Senate in front of Mitch McConnell and put his thumb down like this and say no, because he was a deciding vote on not only what was going to happen to the Affordable Care Act, but also what was going to happen to traditional and expanded Medicaid. If that bill would have passed, and thank you, Congressman Patrick, for voting no in the House. If that bill would have passed, the expanded Medicaid would have disappeared for Pennsylvania and for Bucks County, and the traditional Medicaid would have been block granted, which would have meant that we would have had a lot less funds dedicated to Pennsylvania to pay for Medicare. So we've got to really be diligent and to make sure that we are watching what's going on with Medicaid, not only on the federal level, but the state level. And the one thing, and we talked to the delegation, that they tried to do last year, and it was a Representative Seth Grove from the Republican caucus, is that make sure that we keep the physical side of Medicaid and the behavioral health side of Medicaid separated the way it is now, because the county manages the behavioral health setting. We do not want to merge them back together. That would be a disaster for us here in Bucks County.
So I'll let Antoinette respond if she cares to, while I promote a couple of other folks into this conversation. Tam St. Clair, who has questions regarding the Family Care Act bill, and also Peg Kwan, who's a reporter from the Courier-Times, will be coming to you as well for your question. But go ahead, Antoinette, if you would care to respond or add to what the commissioner said. Oh, you're on mute.
Oh, can you hear me now?
Yes.
All right. I would just say I agree with everything Commissioner Deidre Allman said. Monday is actually the 10-year anniversary of the Affordable Care Act, which gave us Medicaid expansion. In Pennsylvania, over 700,000 Pennsylvanians have been able to get covered. And that plays a huge role in making sure people have what they need to stay well and stay healthy. In this time of crisis, Medicaid expansion allows us to grant Medicaid to individuals up to 138% of poverty, which is about $18,000 for an individual. So as folks lose job-based employment and coverage, Medicaid expansion will be a critical lifeline for those services. So, you know, we should take a minute to celebrate on Monday, because we couldn't be where we are today in terms of making sure people have healthcare coverage to combat this, and then also make sure that, you know, those programs remain protected as this goes forward.
Thank you. Okay, let me actually have Tam go. Well, let me push pause, Tam, unless you want to add to this conversation, but I don't want to go to Senators Collette and Thomas just yet. So if you want to add to this conversation, please go ahead.
No, I wanted to change the subject just a little bit. Adding to this conversation regarding health care, The nurse practitioner bill has been passed in the Pennsylvania Senate that would expand nurse practitioners' full practice authority. We know that during this crisis, there's a lot of pressure on our providers to be able to meet the demand. And I was wondering if the House Licensure Committee, and this is probably to Wendy Thomas because she's on that committee, would be more open now to address that need to have our providers, the nurse practitioners, be able to deal with the demand of on the providers at this point.
Great. Thank you for that question, Tam. And I'm going to have Peg ask her question at the same time, so then I can bring in Senator Collette and Representative Thomas, since both questions are really directed to the state level.
Hello.
Hi, Peg.
Hi. My question deals with the current crisis, and what guarantee is there that there will be people in the federal and state offices to process all the new claims that will need to be processed for Medicaid and for SNAP and other, and I guess the Affordable Care Act? And also, are there measures being taken for the pantries to protect the people? I saw yesterday in one story I was reading that there's a desperate need for food and diapers, but that the pantry workers, most of them are older and some of them are not reporting, so they need younger people. But it seems that everybody out there working with the public needs to be protected. So will there be guarantees that these people will have protective measures, as well as daycare workers, even as I believe it was Congressman Fitzpatrick said that the families of police officers and people that work in hospitals will need daycare. So will there be people, protections for the people that have to do that work?
Great, thanks for that question. Do you have any information on that, Representative Thomas? Or Senator Collette, you should be on and unmuted now. Hello. Welcome to the conversation.
Hi, this is Senator Collette. I don't know how to use my camera. I apologize.
No problem. We can hear you fine.
As long as you can hear me. So, I can offer a little bit of information with regard to that. We have been hearing locally that some childcare centers are going to be opening up for emergency workers. So people that are working in our hospitals, people that are our first responders, and that some childcare centers are getting special dispensations. They're working with Department of Health. They're working with our, leadership in the state to make sure that they are following all of the guidelines so that they are being safe, they are being sanitary, they are providing good care. But there are, things that we need to do to make sure that our first responders and our emergency personnel are able to, get to work so that they can continue to do that. And I know that we have a real shortage of childcare when it comes to how many people we do need to be out there in the community. But we're working on everything that we can. I know that Mitzvah Circle, which is a really great organization here locally, they got a huge donation of diapers. So that came from Huggies. And so we're really excited that they're going to be trying to get those out into the community. We're doing everything we can to implement protocols and constantly review and improve the requirements that we have so that child care providers for those essential personnel will be able to be implemented. But it's something that's a growing concern. Every one of us is new to navigating this, so we're doing everything we can. Just in response to the issue that was raised by Tam St. Clair earlier, that I saw in the chat box talking about family care, sick leave, medical leave. Those things really do have to be in the forefront, and we've got to make sure. And I think there is a shift, as Wendy said earlier, when the House reconvenes, when the Senate reconvenes virtually, because we're doing all of of our voting virtually. When we start to do those things, that's what we're looking at. Those are the packages we're putting together. Relief for our schools, relief for our small businesses, relief for our childcare providers. Those are the critical issues that need to be in the forefront right now so that we can make sure that our townships are running as smoothly as possible in this time of crisis and indecision.
Thank you, Senator Collette. Representative Thomas, do you want to add to that?
I want to just say ditto, I think. I think the senator covered it well. To Tam's question directly on the nurses, honestly, we have been just urgently trying to keep up every day with new direction about keeping our community safe, that we haven't talked about specific bills. I'm hoping we can get there Monday. So to the nurse question or family leave, those are all topics we need to talk about. But so far, the conversations have been very much focused on the urgent need of the day, or frankly, the hour, as you see direction come from the governor, sometimes 2 and 3 times a day. So please know that we are concerned about these items and we're dedicated to working on them. But right now, we probably have each gotten 500 emails based on the close down except for life-sustaining services that happened last night. So, give us a little bit of time, but we are focused on these things.
Thank you very much. And I saw Representative Allman with her hand raised. I'm trying to find the right profile to promote. There you are. Hello. Would you like to comment more on what your colleagues in the House and Senate have said? You're muted right now. Hold on.
Are we good?
Go ahead.
Okay. I just wanted to add this one component, and obviously we have so many different oranges in the air. I don't know when we will get to this one, but I think it's ironic that we are all being made aware that our childcare providers are absolutely key to running our economy. Yet they remain among the lowest paid workers. Many of them are below essentially a living wage, and we can't raise the minimum wage. These childcare workers are absolutely critical to running our economy, and they need to be paid more fairly for what the work is that they do. Just wanted to add that piece of information. There's more things to talk about. I'm going to put my hand down.
Thank you. I am actually going to go now to, we have staffers for each of our federal level senators in the Zoom webinar today. So I'm going to go to Lara, and if I can find you, Senator Toomey, there you are, Corinne. And unmute.
I don't think it's supposed to be me. I work for Senator Collette.
Oh, I'm sorry. See, everyone who has very long names are difficult to understand. All right, we'll demote you back. And if Senator Toomey's staffer is still here, can you raise your hand? Because it's a little hard to read the longer names. Is it Jackie? Can you raise your hand? Nope, that's Representative someone. Okay. Well, let me just ask you, Lara, while I'm looking for this other person. Oh, I can't.
Looks like Lara's there.
Yes, it looks like she's here, but without audio or video. Unless you can hear us and talk, Lara. She had shared something earlier in the chat box, actually, just to let us know that her boss, Senator Casey, is pressing the administration to on the needs of children and early child care providers during the coronavirus pandemic. So I was going to ask her to say a bit more about that. But I'm sorry, Lara, we cannot seem to enable your audio right now. So with that, let me move on to, and I was going to ask them the question here as well about considering penalty forgiveness on student loans. But let me move instead to Julie Duggery. Let me ask you, Julie, you have some very helpful information here about what NOVA is doing during this time. Everything was working so smoothly. It was going too well, guys. All right, let me see. Julie, can you talk now? How about now? Hi, Julie. And she may have stepped away too, you never know. Well, I will just highlight some of the information she shared with us here on what NOVA is doing. NOVA is still continuing to provide support to victims of sexual assault and other serious crimes, and they have telecounseling services as well. So I think this is important information, and if you look over in the Q&A panel, if anyone who it represents an organization where this would be helpful, please do share this phone number as the gateway for connecting with all NOVA services to know what their capabilities are during the pandemic time. Oh, Julie.
Sounds like Julie.
Hi, we can hear you now.
Oh, great. I'm sorry.
No, not at all. I'm sorry. I didn't give you much warning. Can you say a little bit more about what NOVA is doing and needs?
Yeah, so I just wanted to make people aware that we are active as ever, providing services to victims of sexual assault and other serious crimes. Our counselors have already been providing counseling services via telecounseling, and they are ramping up capability. So this has taken some adjustment, but they're well on their way. Our victim advocates are also available to people that are engaged in the criminal justice system, which now might be a little confusing for people because of some of the restrictions in court proceedings, both at the, here in the county and also statewide and with the Supreme Court. So our victim advocates are available by phone and by email to anyone that's engaged with the system. As well, for the protection of child victims, our Children's Advocacy Center is seeing children. Right now in the Jamison office, I believe it's restricted to that office only, but those services are available. And last but not least, victims of sexual assault can see and get services through our SANE, our sexual assault nurse examiners, at the area hospitals, and that again is a service that's available 24/7. And our hotline is up and running. Our staff and our wonderful volunteers are continuing to staff that. So people can call 1-800-675-6900 to access those services. I do want to remark for the state reps that in the budget process, the request, there was a request for increased funding for rape crisis centers across the state because there has been an increase in requests for counseling services. There were a lot of victims of clergy abuse, the Boy Scout grand jury, the Jehovah's Witness. So there is a great need for counseling services, and we are hopeful that as the discussions continue around the budget, that there will be some attention paid to the needs of victims of sexual assault.
Great, thank you so much. Before I dismiss this comment from the question and answer window, I'll give everybody a few more seconds if you want to copy and paste any of this information from Julie, and then I'll dismiss this. I think I did manage to enable Laura Flynn's microphone now. So Laura, if you want to give us an update of what Senator Casey has been working towards.
Yes, that would be super.
Hello.
Thank you so much. My apologies. Can you hear me?
Yes, we can.
Excellent. Great. So thank you all so much for joining. This has been a wonderful program. I've attended in person the past 2 years, so I'm happy to be with you over the phone today. So just wanted to share with you that Senator Casey did a Facebook Live town hall last night at 6:15, and we have over 3,000 people from across the Commonwealth who were able to view. Just sort of hearing, what it is that's going on in Washington. Obviously, Congressman Fitzpatrick shared with us at the top what's been going on with the Families First Coronavirus Response Act, as well as the Paid Leave Act. We understand that last night, Senator McConnell unveiled what he believes is going to be appropriate for this third piece. There's like these different packages that are moving through the Senate. Senator Casey in all of this is going to be focused on emergency appropriations for healthcare response, monetary aid to families, local and state governments, and relief to small businesses as well. Just wanted to share with you that the senator will remain in Washington until this legislation has been passed by the Senate. If folks have any other questions or anything along those lines, please check out our website, which is casey.senate.gov, and we're posting kind of all of our updates there. But more to the conversation that we were just having, and thank you. Nova has been a wonderful partner that we've been working with closely. I know it's hard to remember what it was like kind of before COVID, but in between impeachment and COVID, Senator Casey did roll out what we are calling a new Marshall Plan for Children. It's the 5 freedoms for America's children. And Nova actually joined us at the Please Touch Museum in February, and a few other folks from Bucks County were there as well, joining with Senator Casey in making this suite and package of legislation for America's children. So I just want to very, very briefly explain, this is also on our website, casey.senate.gov, but basically it's 5 principles that really speak to a lot of the issues that we've been discussing this morning. The freedom to be healthy is a proposal that would recommend automatic Medicaid eligibility for every child born in America through the age of 18. There's also the freedom to be economically secure, which would seed $500 annually into a child savings account, which then when the child turns 18, the child can use the account for post-secondary education, home ownership, or a business enterprise. We also specifically focus on access to quality, affordable childcare and early learning programs, serious investments, billions of dollars into affordable childcare, early learning programs, Head Start, et cetera. The freedom from hunger is about expanding universal school lunch and breakfast, so making breakfast and lunch eligible for all students at K-12 programming. And then the last one, and this is what Julie was just speaking about, is freedom to be safe from harm. This proposal recommends $250 million annually into community-based child abuse prevention, additional $250 million for child protective services, an additional $250 million a year to the state attorney general in order to prioritize investigation and prosecution of crimes against children. So this is big, this is bold, this is really transformative in the way that Senator Casey believes that we need to, as a federal government, invest in our children. Obviously, we're going through a crisis right now, which is really highlighting a lot of these issues, and we're hoping to gain momentum. So if you have questions or you're interested in learning more, please check out kc.senate.gov/5freedoms. Thank you so much.
Thanks for sharing that with us, Lara. So we are coming to the end of our time in this conversation, incredibly, and I want to bring our panelists back in. We've had a lot of questions and comments and back and forth with the elected officials. Do you all have additional thoughts that come to mind as you hear this conversation?
I'll go. I think that obviously we need to all work together. And as we work together to get through this crisis, I think it points to how we all continually need to work together to change things for the future, to look at our systems in the future and how they work or how they don't work. And that has become very clear in this particular situation. So I think we all really need to commit to working together to make things better for everybody in the future.
Thank you, Barbara.
Yeah, and I would just echo the sentiments, right? We are facing probably the biggest public health crisis of our lives. You know, this has shown us where there are gaps in the social safety net, right? So when you talk about social distancing only works if folks have access to paid time off, so they're not going to work to try and survive, right? If they have affordable quality health care, they get the care they need, you know, quality education, it shows the flaws in our social safety net system. So I think, you know, this will provide tremendous opportunity for us to continue to come together and advocate for the important components of the social safety net. And it's also a time for education, right? We expect more people now than ever are going to need things like free health care, unemployment benefits, SNAP, LIHEAP. So it's also a chance to elevate the benefit and the value of the current social safety net and how we work to improve it for everyone. And, you know, I just want to offer one more time, you know, our helpline is a resource for folks, 877-570-3642. We also put together a briefing memo that hopefully can go out to folks that attended today. Our briefing memo covers, you know, what are the changes in eligibility benefits, what programs are out there in terms of, utility shut-offs, county assistance offices. So we can make sure folks get that. It talks about how to apply for unemployment. So folks can kind of have an easy reference guide to figure all this stuff out, with the caveat that it's changing daily, but we'll continue to make sure it's updated.
Thank you so much. And I'd like to bring in, as sort of a wrap-up question, an overall question from our board member and President Emerita Nancy Morrill. Nancy, go ahead with your question about the changing nature, what the pandemic might change about our environment.
Thank you, Amy. I'm just wondering if all the elected officials at federal, state, and local level feel that this crisis will provide a reorientation of the philosophy and the commitment to the value of the safety net.
And I'd like to actually kick this first to Rose Wenchel, if you're still here, for Senator Sanacero, because you had a couple of comments, and maybe you can take that question on while also adding the comments you wanted to add. Hold on. Sometimes you have to do these things several times before it takes. There we go. Hello, Rose.
Good morning, and thanks for having this wonderful program today. I think, it's too soon to tell exactly what, this new landscape is going to look like going forward, but it certainly has provided some important things for people to consider. I think we're learning every day the nuances of all the current regulations and, how, for instance, how it pertains to our school employees, which of them are hourly workers, which of them are covered by the state code, and how their jobs are protected. So I think we're in this mode of really getting a deeper dive into a lot of the policy questions that we need to consider going forward to make our economy work better for everyone.
Thank you, Rose. And I see you also say that Senator Sanacero will be hosting a Facebook town hall at 4:30 p.m. today, so you can continue this conversation with him at that time as well. I've also promoted State Representative Perry Warren. Perry, if you want to address Nancy's question and anything else you heard today.
Amy, am
Hello.
I?
Yes,
Oh,
you are. Hello.
hi.
I see you.
Hi. I just want to say we are, although my physical office is closed, Regina Garrow from my office and I have been on the call all along, and we are all working from home. Hi, Regina. Haven't seen you in a week. And I think we are seeing the impact of the social services and that have been ignored over the past several years. And in reference to your question, there really is a growing realization that this crisis is only a few days old, and people are already suffering. And that's how challenged our social structure is. And I am optimistic that we come out of it with a recognition of the importance of many of the issues that we've discussed today, and a more, using an old term, a kinder, gentler society that recognizes that the crushing student loan debt, the fact that people don't have savings to handle an emergency like this, and to address the needs of our neediest people. So while we don't know what lies ahead, I'm optimistic that at the end, we will have a better recognition of the challenges that have been too much ignored over the past several years. Thanks.
Thanks, Perry. And I know several, can you mute your line, Perry, or maybe Kathy can for you? Thank you, a bit of an echo. State Representative Frank Ferry had also joined us at the beginning and let us know in the chat that his office is working hard to help people. So he encourages, if you're one of his constituents, to please reach out. And Representative Allman, do you want to comment on Nancy's question or anything else you heard?
Yes, I would like to just respond. I think that this has been opportunity is not the kind word to use. It's been a requirement to revisit our priorities, to realize how fragile the safety net truly is. And I just am hoping for wisdom among all of us at any level to be able to figure out this situation, why we take stock in the 3 different areas that we have to use for making wide decisions: our hearts, our heads, and our wallets. The budget's going to be a concern. Obviously, this is going to be incredible economic impact, and so many people will be suffering. But we also need to make sure that we take care of those who are in greatest need, and we also have to look long and hard at how we will pay for all of the things that we suddenly will need to appropriate. So this is a challenge I know that every elected official and all of you folks here at BCWAC are working really hard to find the wisdom to find our way through so that we will emerge whole and healthy as a society at the end of the day.
Thank you very much. And thank you so much to everybody who participated in this conversation. It honestly went somewhat smoother than I thought that it would. So at this point, I'd like to turn it back over to Kathy Beveridge. Thank you very much to our panelists for giving your time, to our elected officials for giving so much of your time in this environment where I'm sure there are a lot of demands on your time. Kathy, thank you.
Great. Well, thank you very much, everybody, for your participation. And I really thank Amy for her very capable facilitation of the conversation on a new platform for us. I thought it went extremely well, and we're really grateful to everybody for hanging in there, for getting involved, participating, to our techie people for troubleshooting, Lindsay and Louise. And it's been a really great conversation. Some very challenging issues right now, obviously. I am glad to be with all of you discussing solutions. I'm glad to be working with such excellent elected officials on these challenges. And we will be, of course, the coalition will be working to address these issues and concerns in all of our advocacy, particularly as we meet with our elected officials on Advocacy Day, which is April the 7th. Virtually, we will be doing those meetings. And I just ask you, if you're still on this call and you care about these issues, please get involved with us. Please support the coalition's work in any way that you can. Thanks again to our sponsors, AARP of Pennsylvania and Comcast, for supporting the coalition and the conversation with elected officials. We're really grateful. Special thanks once more to our elected officials who joined us today. We appreciate you taking the time. And after we close this meeting, I'm asking everybody to please click on the link that pops up in the Zoom window and complete our survey to help us make this event better. If you don't have time to do it today, don't worry. We are going to send you an email with the link on Monday. Hopefully a video of this event will be up on our website on Monday as well. We'll include a link to that if it's ready. And I'll just end with a thank you. And please stay healthy, stay safe, have a good day, a good weekend, sheltering at home with your loved ones. And we hope to see you in person again soon. Thanks, everybody.